A very good evening to all of you. Today we are going to do radiology. How is your preparation going on? Anybody please comment. Are you doing 100 MCQs daily? At least 100 MCQs. If you do more, it's better. But do 100 MCQs daily. So today we are going to do radiology. So let us begin with the first question. It has a weightage of about 10 questions. Which of the following is the most likely diagnosis patient with following chest X-ray? Look at the X-ray carefully. You can see a boot-shaped heart. Boot-shaped heart means statology of Fallot. It is called as Corin's abort. So the correct answer here is C, top. Which sign is seen on USG when the femoral vein meets the great saphenous vein and femoral artery at the saphenofemoral junction? It is a Mickey Mouse sign. It represents the normal anatomy of the common femoral artery, common femoral vein, and the great saphenous vein on ultrasound at the level just inferior to the inguinal crease. Radiation dose monitored in occupation of a person is done by A. Linear accelerator, B. TLD badge, C. Gamma camera, D. DM counter. It is TLD badge. A remote after loading dose used in A. Brachytherapy, B. Electron beam, C. Proton beam. It is brachytherapy. Identify the given X-ray. Well, you can see a cervical rib. So correct option here is B. Cervical. In which of the following lung pathologies MRI is preferred over CT? A. Pulmonary embolism, B. Tuberculosis, C. Pancreas tumor, D. Pleural effusion. It is pancreas tumor. DSA angiography image is shown. What is the diagnosis? It is a pseudoaneurysm of internal carotid artery. Which gives a negative test on FDG PET? A. Small cell carcinoma, large cell carcinoma, typical carcinoma, or atypical. It is a typical carcinoma which gives a negative test on FDG PET. Investigation of choice for detection and characterization of interstitial lung disease is A. MRI, B. Chest X-ray, C. High resolution chest CT scan, ventilation perfusion scan. It is high resolution CT scan. What is a probable diagnosis? Well, it is a thymoma. Please click the link in the description to join the 3-day Ultimate Neet PG Breakthrough Blueprint class. The original fees of the class is 999 rupees, but it is absolutely free for those who click the link in the description and join. And please attend this class. And if you like this class, then you can continue with it. A middle-aged male patient presents with fever and diarrhea for 1 week and acute onset pain abdomen. For a select abdominal X-ray taken as this is a toxic myoclone. Also tell me which topic should I include in the masterclass. Which topics are you facing the difficulty? You can tell in the comment box. Incorporation of aorta rib notching is seen in 3rd to 9th rib. I'm going fast because the exam is approaching very near. So your speed must also increase. Speed must there should be speed as well as accuracy, and this comes with practice. And in original exam MCQs come. We do a mistake by leading a lot of theory and not practicing MCQs. If you don't practice the MCQ, you can sometimes mark a known MCQ, a repeated MCQ wrong, and which will cost you the rank. So I request you to practice at least 100 MCQs daily. Revise theory from the revision book, whatever book you are having or whatever notes you have prepared or whatever notes you have attended, revise that again and again. So this is a TBI giant setting. And if you have any doubts, any difficulties, you can always WhatsApp me on the given number. I will promptly address your concern. Judate view of X-ray is a pelvis. Puff of smoke appearance is seen in Moyamoya disease. FAST stands for focus assessment with sonographic photometry. Which of the following gland tumor produces hot spot on technetium per nectate scan? It is the adenolymphoma. Investigation of choice for leptomeningeal carcinomatosis is A. PET, B. SPECT, gadolinium enhanced MRI, CT scan. It is gadolinium enhanced MRI. Which of the following is used to differentiate between epidermal cyst and arachnoid cyst? It is DW1 MR sequence. Which artery is dissected most commonly following arteriography by femoral root? It is the inferior mesenteric artery. Well, this masterclass is a 3-day class on demand by students. I have made it a 3-day class, and it will cover all the 19 subjects in a holistic manner. In fact, it will boost your revision and take you to the next level as the exam is approaching very near. This revision masterclass will take you to the next level of your NEET PG exam. Radiation exposure is least in which of the following procedure? It is McJartin's hysterectomy. Frontal sinus can be best visualized by Caldwell. Best assessed by NIRS, near infrared spectroscopy. Icon side appearance, we all know it is incorrect. TG. An absolute contraindication of MRI is, well, in fact, all of them are absolute contraindications. All of them are contraindications. Now, cochlear implant is also. So this question is not correct. Hampton hump is seen in pulmonary embolism. Most sensitive. Sonological integrated aneuploidy is mutual transmission. Gold standard for diagnosis of osteoporosis, it is dual energy X-ray absorption.